Have you ever heard of slit lamp neck, tech neck, or just having neck problems in general? Well, in today's podcast, we're going to talk all about those healthy postures. That's right. You got to sit up, not do this number, not do this number, not sit in the chair this way. Oh, my friends and family, it's going down today. Thank you so much for tuning in. It's your favorite optometrist. Let's go.
This is a Defocus Media production.
Audio Jungle.
What's up, everyone? It's your favorite optometrist, Dr. Darryl Glover.
And I'm Dr. Jennifer Lyerly, resident optometry nerd.
And welcome to Defocus Media, optometry's #1 podcast, where we discuss the hottest topics, latest technology, eyewear, practice management, and more. So sit back, relax, and defocus.
What's up, everyone? It's your favorite optometrist, Dr. Darryl Glover. Super excited because I get to hang out with one of my colleagues that's right down the street. This was the first guy I referred my first cataract surgery to. So we go way back. I'm talking probably almost 10, 11 years now, which means I'm becoming a seasoned optometrist. I'm becoming an OG in the world of eye care. Friends and family, I'd like to welcome my colleague, Dr. Daniel Simon. How you doing today, my friend?
I'm doing great. I'm happy to be here.
Man, isn't it crazy how long we've known each other? And I think when I first got out, did you first get out of school as well? And that was your first years of practicing or what?
I had a job for about 3.5 years before coming to the area here, but I was doing a little math, and that was almost 15 years ago. I've been, since I've been here. So it's been a while. A few more grays, a few less of these up top. So.
Well, hey, man, I'll take the grays any day because as you can tell, there's nothing up top here, right? So grays are a blessing. But now I'm starting to get the grays here, the only place I can really grow hair on my beard, right? So fun times, I must say. But, man, super excited to have you on the podcast today because we're going to talk about a topic that really impacts all healthcare professionals, right? But most importantly, it really impacts eye care professionals. And that's whether you're an optometrist, an ophthalmologist, a technician, it doesn't matter who you are. At some point in time, you're going to have some pain and some discomfort. And last year, I was able to catch a lecture that you did, a continuing education lecture, and I was just blown away by some of the information that you touched on. And at that moment, I was like, man, I need to have him on the podcast because I got to convey this message to the masses. That way, my eye care professional friends can practice to the utmost and feel comfortable and have a long career as well. Now, before we jump into this topic too far, Dr. Simon, I really would love for you to share a little bit about your background, maybe where you're from, where you went to school. And we also love fun facts, my friend, if you don't mind sharing as well.
Yeah, I mean, I'm a native of New York. I grew up in Long Island and am a product of the State University of New York education system. Went to college in upstate New York at Geneseo and went to medical school at Downstate in Brooklyn.
Okay.
Did my internship at Beth Israel in Manhattan and then matched in my residency down in Eastern Virginia. And my wife and I realized that we didn't actually have to live in only 600 square feet. So that's what drew me sort of down south. And I worked out in the Charlotte area for a few years. And then, like I said, I came here in 2009. I just as a comprehensive ophthalmologist, I see just a little bit of everything. So, I've seen my fair share of doctors go down with neck injuries, and that's what kind of piqued my interest. I didn't want to become one of them. So,
right. Awesome, man. So share a fun fact.
Fun fact. I had a radio show my freshman year of college, WGSU FM Geneseo, Saturday nights from 8 to 11.
Okay. And were we playing music or was it a talk show?
No, this was 1994. So that would be, about 3 hours of spinning the latest alternative hits.
Okay. All right. That was going to be my next question was what genre of music and were you tapping into any hip hop at that time? Because the 90s, man, it was some great hip hop during that time. I'm talking Biggie, Nas, Tupac. I mean, some of the best times ever to be alive whenever it comes to hip hop during that time. You know?
Yeah, we had a pretty strict format. It was an alternative format. And so, it was a lot more of like, Nirvana, Pearl Jam, Smashing Pumpkins, Stone Temple Pilots, some more esoteric stuff that you would kind of only hear on a college radio station. I didn't get a chance to play too much hip hop, but I loved it. I was into it.
Well, hey, you were in New York, so you were in the mecca of it, right?
Yeah.
During the prime time. So I know you just, took it in and got to probably see some amazing things during that time.
Oh yeah, yeah. That was right after the whole. That was right after the West Coast blew up too. So,
man,
it's a great time for music.
I always say, our age range, we've been blessed, man, because we had the best music. I think personally, some of the best fashion. We were able to see before the internet, right? We've been able to experience social media, right? We had our first Black president, diverse president, right? We've seen so much during our lifetime, right? That it's just an amazing time to be alive. And, in order to really live our best lives, we got to make sure that we're taking care of our bodies.
Absolutely.
Today I love to dive into healthy postures. I know my posture's jacked up. It's no doubt about it. Sometimes I'm in the exam room and I think I'm damn near laying down on the ground, right? I'm just moving around and doing this and talking to my patients and acting a fool in the exam lane, right? But always having a good time. But you and I were kind of socializing some questions prior, and I saw this term that I'm assuming that everyone is aware of, and that's known as slit lamp neck. I can't even say it. I keep messing it up.
It's not easy.
Right? Say it like 5 times. But I'd love for you to just, talk about this terminology, this name, this concept, because I know it impacts a lot of us as eye care professionals. And, how do we end up developing this?
Yeah, slit lamp neck or tech neck. These are terms I've heard. When we go to examine a patient and we want to align our eyes with the oculars of our slit lamp, there's this sort of natural tendency to put our necks into extension. So this way.
Yeah.
And it's very bad. It's very bad for us. It's not good for our cervical spine. And, so you combine that with, our patients' chairs and our chairs not being adjusted properly. And then you factor on top of that how so much of our work now is with a keyboard and mouse. And when we're not working, we're either looking on a tablet or device or our phones. And, we all do it, right? I do it too. We sort of hunch over the thing. And that's how these problems start to crop up.
Gotcha. Now, how frequently are you seeing this take place, especially in your practice? I mean, you're with a huge organization, and I read somewhere that for ophthalmologists, it can be seen, or some doctors can experience this to up to about 50%. And there were some studies that even stated 66%. And I was like, man, that is very frightening. But I'm curious to know what you're seeing firsthand.
I mean, I was exposed to this early on. My residency training, one of my mentors and teachers, we were lucky to have her, and we had her for more time because she couldn't actually practice as much because of her cervical disc herniation and subsequent surgery that she had. And that stuck with me because, right from the get-go, I had this teacher who I respected, who was really great with patients, who really couldn't do her job because it caused her pain and numbness and tingling in her hands. Wow. And since that time, honestly, in the last 10 years, I've seen 2 of my colleagues need surgery. 2 people who I work with on a regular basis need surgery. And so that's just some anecdotal, evidence that this is common. We see this a lot. Other health professions too, like dentists are known to have a higher rate of this as well. But for us, I think this, the slit lamp is definitely problematic. And for those of us who do surgery, the operating microscope is a big culprit also for the same reasons.
Now, it's one thing to be a healthcare professional, but it's another thing to be a patient or just a human being, because the other term that you mentioned was tech neck. In today's society, we live on these digital devices, right? Cell phone, tablets, whatever, Kindles that are sitting in front of us. How has that conversation been in the exam lane with your patients? Because I'm pretty sure you want them to have the best posture and not have any issues whenever performing any kind of surgical procedures. And it's good to plant the seed earlier, right? So when they get older and they need cataract surgery, there's no headaches or bumps down the road when it comes to the procedure.
I mean, I think from my perspective, I always just take a few extra moments when I'm examining my patients, when I can. I'm much better at this when my schedule is not triple booked, which is pretty often. But you want to take. I always take an extra moment, and I think there doesn't have to be much conversation with them about this. You're just adjusting their chair, and I can get into that too. Like your chair and their chair, you want your eyes at about the same level. And I think, people don't need any real explanation there. You want to adjust the exam chair so that your chair wheels can actually slide underneath their footrest. Because otherwise there's too big of a space between you and them, right? And then that is what leads to you leaning forward like that. And so people mind much more sitting in your waiting room than they'd mind the few extra moments it takes to adjust that. Now, I don't get too many questions from patients themselves about what they should be doing and positioning themselves. It's a lot more questions about, what effect the screens are having on their eyes. But I feel like, we try and set a good example for people.
Gotcha. So whenever a patient comes in, and I'm just curious to know if they have some kind of neck injuries or something like that, does that impact whenever you have cataract surgery or any type of glaucoma things that you may dabble in, or how does that work? Because I know as an optometrist, I can start planting the seeds now because I educate my patients all day about computer glasses, blue light protection, anti-glare protection, lens enhancements. But I do feel like we got to take it to the next level and talk about ergonomics, because it's very important to have the proper ergonomics to be able to see properly and not to dry the eyes out and cause other complications as well. So I'm curious, should we team up more and I should be planting that seed so it sets you up for better success, or does it really not impact you and it's more of the eye care professional that's impacted?
I mean, if I'm being honest, it's not something I haven't thought about it from that angle. But as you say that, I'm like, man, when we have somebody who's laying on the operating table and they can't lay flat because of the sort of the kyphosis in their neck, we could work around it. It makes things a little bit more challenging, but it's manageable. And it's tough. I think, trying to be preventive about that. I mean, it's great when you can counsel younger patients to, when they're asking you about how it's affecting your eyes, just to remind them, hey, this is not just affecting your eyes. You got to be mindful of these other things.
Right.
So that's a good spin.
So kind of talk to me a little bit more about some other techniques that can be used when you're in that exam lane. I mean, I understand eye to eye, rolling the wheels underneath the chair. Are there any other tips or pearls that an eye care professional that's listening to this today can go home and implement right away, or go to their practice and implement right away?
Yeah, I mean, I think those are big ones, because I had a fair amount of, just not anything serious, thankfully, but just some discomfort, some tightness in all the muscles in my shoulders and my neck, and it was coming up and causing some headaches and all that. And those simple adjustments, right? Taking an extra moment to be mindful that you were lined up with your patient, that you could actually get close enough to the slit lamp so that you didn't have to crane or stretch your neck. Those made a big difference for me. Sometimes you can't help it, right? The patients, they're just not necessarily able to be positioned in that manner. And, sometimes you got to take the hit. But there was that, and some adjustments that I personally made in the operating room with how my microscope was adjusted. You can't really do that with a slit lamp, but some slit lamps do have longer eyepieces that you can purchase. That could be helpful. Honestly, I started working with a trainer. I know that's a luxury not everybody has, but because I went in there saying, look, this is a problem that faces, that so many of my colleagues face, that I want to be as proactive as I can. And so, a lot of upper back strengthening exercises and core exercises made a big difference for me as well.
Yeah, and that's something I wanted to touch on is the core, because I mentioned this on several podcasts over the last 4 or 5 months. Last year, I had some very bad back pain. I mean, to the point where I had issues bending over, and I ended up going to see a physical therapist, and they told me that all I needed to do was stretch. And ever since then, every day I've been stretching, and it's been a game changer in regards to how I feel in the exam lane. And as I started to think a little bit more about it and having other guests on, I thought to myself, damn, the core is very important. We really have to strengthen that to be effective and to work comfortably in that exam lane. And it sounds like you've been hearing the same thing and doing the same thing as well, strengthening that core to make it easier for you to examine those patients and work with the slit lamp as well.
Yeah, and it's not like a conclusion you would naturally come to. Like, how does, working my upper back or my core help me examine patients more easily? And really, it in a few different ways. Honestly, I think when you're engaging that part of your body, you are more mindful of it. You have a greater awareness of it, and that's something we can talk about too, is mindfulness. But just simply exercises that kind of pull your shoulders back, because there's so much of what we do hunches our shoulders down and hunches our neck down this way, that just opening up your chest and getting building up some strength in your back, your core helps you to kind of sit upright with less effort. All those things make a big difference.
Gotcha. Now, one thing that I was really intrigued about, and I'm starting to dabble in this a little bit, is when you had this lecture, you talked about the importance of, yes, exercising, stretching, but really yoga. And, as I get older, all these things that I used to sit back and laugh at and say, yoga, I would never do that. Now I'm like all bought in. I'm like, sign me up. I need this help. I need to make this body last.
Yeah.
I would love for you to maybe spend some time about and discuss, some of these various techniques, and maybe even show some of these techniques if you don't mind. I know you got the secret sauce in your back pocket. You're married to the secret sauce that can really help educate us. So I'd love for you to maybe do an introduction to who's going to join us this evening. And, let's kind of dive into some of these different techniques that our eye care professionals can use at work and at home.
Absolutely. My wife of 22 years, Jill Simon, is a certified yoga teacher. She's got over 500 hours of teacher training under her belt.
Wow.
And, the lecture you were alluding to, we unfortunately had a big sort of tech malfunction where we couldn't get the audio to work. So I couldn't share this with everybody. So I'm pretty excited to get to share this here. But yeah, there are numerous studies that show the benefits of mindfulness-based stress reduction, so meditation, mindfulness meditation, and yoga for reducing chronic neck and back pain. I can try and fumble my way through it, but I figure let's let the expert show you. So I'm going to turn the camera over to her here.
Yeah.
If you don't mind. So
yeah, let's make it happen.
Introduce you to Jill.
Hey, Jill, how are you doing today?
Hi. How are you?
I'm super excited and thankful that you're joining us today. I was telling Dr. Simon, your husband, that this is a hot topic. As I become more seasoned in age and more of a future presbyope, my body is changing, but I also see it with my colleagues as well. So I'm super excited to learn a little bit more about these techniques on how we can be better in the exam lane and last longer in regards to practicing. So I'm kind of going to let you take the show.
Well, thank you. It's very thoughtful of you. So the first thing I think that is important is the idea that you can pause for a moment and just like reset, right?
Okay.
Dan was talking about the mindfulness and just being aware of how your body is, right? So even if you have 5 seconds before you see each patient, right? You kind of get in and you're like all crazed and you're trying to do your thing. Yep. And even just pausing for a moment, like your whole body can soften and relax. And so we can practice taking one inhale and then like 3 long exhales to just let your body know that it doesn't have to hold on to all of that thing, right? There's a lot of research coming out about your vagus nerve and how their exhales and your inhales and your breath sends that biofeedback to just let you know that this is not alarming. We can all chill out about this right now.
I love this.
So if there's nothing else, that's probably the main thing that you can do.
You know, I want you to continue on, but I love this topic because when I think about COVID and I think about us as eye care professionals, and there's not enough of us out there to see everyone, I think about burnout. And I think if we can take the time to actually breathe and take that pause and inhale and exhale, like you're stating, you do that X amount of times a day, X amount of times a week, X amount of times a year, that's probably going to help slow down and reduce that burnout tremendously. So this is something that's a very important topic and that we got to implement right now.
For sure. And it's easy, right? You don't need to have like super high training and meditation or have gone to any other things to just realize that like you can exhale for a little bit longer than your inhale. And that's a little bit of the key of it is so whatever breath you've taken in, your exhale is longer than your inhale. So even if you think about it, we usually think of like a 3 breath inhale and like a 6 breath exhale. Most people, or 6 count exhale, most people can manage that. And it's a little effortful, right? Like it's a little bit of thought to make that last piece be your exhale. So we can try, right? So on the count of 3, we'll inhale for 3 and then exhale. And you can feel like as you're letting go, like in order to blow the air out, everything has to soften. So if you do nothing else, I would say that's the primary thing.
I love that. I love that. What else you got for us? That's an easy one. That's something that everyone can take notes, go into the practice tomorrow and make it happen. And you know what else I'm thinking about doing? Every time I walk into my house, I may need to do that before these kids, my wife comes screaming my name, you know?
I would just say you could even do it in the car before you get out of the car. It's not unheard of that happens. Just like reset before you make the next step. And it doesn't interfere with your day.
I got to tell my wife about that technique. I dropped the kids off every morning and I came back home this morning and I saw the garage was open. I was like, what the hell? She left the garage open. And as soon as I was walking in, excuse me, there's a little bug in here. As soon as I was walking in, she opened the door and her car door. And I was like, what's going on? And she was in there trying to exhale and do all that other jazz as well.
Mm-hmm. Yeah.
All right, what else you got?
So the other thing I would say is I know that when you all are getting ready to do your exams, you have to do a lot of like leaning forward and getting your arms up and getting into position. But one thing that you can do is pelvic tilts in your chair, and nobody even is going to notice that it's happening, right? So if you think about where your ischium are, which are the bony parts, the sits bones, you can tip your pelvis forward so that you're off of them, and then you can tuck your pelvis the other way so that you're rolling way back onto them. And there's probably a Goldilocks spot for everybody, and it's not going to be the same. But we tend to tense up, get real engaged, and then also do that rounding forward. So if you can do a little bit of a pelvic tilt where the top of the pelvis, the bowl will tilt forward a little bit and your bum sticks out a little bit behind you, you'll actually find a little more length in the spine rather than that lumbar rounding. And that's just a postural piece that's gonna, if you can take that moment to do that. And your butt has to get involved to hold you up that way. And so there's a term called glute amnesia for people who are sitting for so long. Like your glutes stop doing the work and they're supposed to hold your body up. That's their job, right? And so if you're sitting for so long, your glutes kind of like tuck under, your back starts to get involved, and all that compounds and becomes bad, as Dan was saying earlier, right? That's how those things compound. So that sort of tall sit, that little bit of like a little Beyonce move, sticking the bum out a teeny bit and finding a little bit of length. And then if you have to tip forward and whatnot, you've got some support in the big muscles rather than using the small spine muscles to do it. So that's the other one that's just seating and might be helpful.
Yeah. Now this one I actually know a little bit about, but I was doing this whenever I hurt my back last year, and I had to do it on my back. And I will tell you, when I first was doing it, it felt weird as hell because I
Oh
was
yeah.
like, "Am I doing this right? Am I moving my butt right? I already have a flat butt as it is, so any
Yeah.
kind of moving around, I don't know if I'm doing it right or not." But it made a world of difference, and it was a good entryway into other exercise that I can do and build off of that as well. That was
For
always
sure.
the foundational stretch or movement that I did to get back to where I needed to be.
And whenever I'm teaching classes, I always have everyone stand for a moment and like I ask them to find the Goldilocks spot because it's different, right? Everybody's bodies and spines are different. So you
Oh yeah,
stick your butt way far out and then curl it way under. And
yeah,
usually neither of those is right, but it's usually more in the direction than is your natural like resting spot.
gotcha.
So
Okay, all right. What else you got for us?
I mean, I have two quick stretches that I think, I mean, I can go on for hours. We can just have a whole meeting. I can give you two quick stretches that I think are
Sure.
really useful.
Okay.
One is it's going to be a little bit of help for whatever neck posture you're working on. So you'll take one hand and you'll bring it over the top of your head to find your ear. And then you'll use that hand as a little bit of tension to pull your other ear to your shoulder. And the dangling arm is actually more important than you think because you have to like actively let it drop. And even just that, you're likely to feel from behind the ear down into your either the front or the back of your shoulder. And you can adjust that by tipping your chin down or tipping your chin up. And then comes your important breath in and your longer exhale. So even a 3 inhale count and a 6 exhale count on one side, and then the other side will just give your neck a little bit of a break from all of that forward crunching and looking.
I like that one. That's again an easy
Mhm.
ask to do in the exam lane, or even before you go into a patient, or even before the first couple of patients, and even at lunch. I mean, there's time in our schedule that's built in where we
Yeah.
can make these things happen and
Mhm.
execute at a high level and feel better for the rest of our lives.
And so then the next one I have is going to go and get, the spot where you can't sunscreen in your back like that,
Yeah.
right? Okay, so it's going to go with both arms in front and it's going to be an eagle arm. And so you'll start with your right arm underneath your left, like you're giving yourself a hug. And then snuggle your elbows together and press the back of your hands together. And so that might be enough, right? Just depending on how your spine is. And then if you think about it, you can lift your elbows to shoulder height and you might start to feel a little bit in the back. And you could tip your forearms away from your body, or you could continue to lift your elbows up and find big extension in your spine. And then you can unwind, breathe in, lift your arms, and then usually we just end up crossing in the other way to make sure you get the other side. But that tends to access that part that you're real crunched in and stretches it in a nice and opening way.
I love it. I love it. So I'm curious, do you two do yoga early in the morning together or in the evenings? What does that look like?
No.
Come on, Dr. Simon, man. You got to do better, my friend.
I gotta do my own thing. I do my own thing.
Well, while I have an expert on the line, I'm curious to know because I have tons of patients that come in. And I'm pretty sure, Dr. Simon, you get the same thing, and they're telling me that I need to try out hot yoga. And I've heard great things and bad things. I'll start with the bad. I heard if anyone ate onions the night before, it is not going to be a fun event, right? But I also heard your body feels incredible whenever you're done doing a hot yoga class. I'm curious to know what your feedback is, and is it something that you would advise people to try out?
Well, I think the first thing about it is super personal preference, right? So, and it is hot is not an understatement. It is hot, like in the hundreds. And so I don't usually recommend it unless you are 100% confident that you have no other confounding health factors where you can be in a sustained activity in a heated room for that long. So as long as that's something that is going to be fine for you, I find a mix of people really love it or they absolutely hate it. The people who love it will say that they didn't know they could find that stretch in their body. And the people that hate it are the people, I happen to dislike it. I heat too quickly and I can't cool down and I get flushed and it feels terrible. So it's not for me. But also the people who do love it tend to be very mindful of not overdoing it to the point where they're going to get injured. So the heat factor really allows you to go right to the edge of your body's natural motion, and then maybe even too far. So I always caution, like, if you're a lover of it and it's going to feel great, I mean, that's amazing. If you never want to live in Florida like me, like, it's not for you. So
Gotcha. So
yeah.
this has all been fantastic. I'd love for
Thank
you to maybe just drop a quick summary, those 4 different techniques that you just mentioned, maybe within a minute. That way we can have that hot take that people can take and implement tomorrow in their practice.
Sure. I have a 5-minute video I can stick in your show notes if that's useful.
Yeah, absolutely. Yeah. So we'll definitely take that. We'll plug it in and we'll make sure that everyone that's listening can take those tips, learn a little bit more. If you're local here in Raleigh, Durham, where I'm at, they could probably go check you out in person and get it.
Yeah.
The real deal, right?
Recess yoga in Carborough.
There you go. Recess yoga in Carborough. And if anybody is a practicing OD or even ophthalmologist in the Triangle area, you got to check out my guy, Dr. Simon. He's with North Carolina ENT Duke partnership that they have over there. Check him out. One of the best surgeons in the area. He does a fantastic job. The thing that I've always loved about Dr. Simon is that he is very personable and he has fantastic bedside manner, and all the patients say,
thank you.
We like him here too.
Well, Dr. Simon, my man, let's close it out, man. I always like to ask this question to all my colleagues. In your case, it may not be as much this actual instrument, but I have a segment that I like to call when it's your turn to retire your phoropter, when it's your turn to leave a legacy. What do you want to be known for, essentially, when it comes to the world?
I mean, you just were so kind, and the idea that I could be remembered as a good surgeon with good bedside manner, I don't know what else you could ask from a career. I really don't. I mean, so that's the ultimate compliment. It really is.
Well, hey, man, you're living it. So I love everything that you're doing. Continue the great work. It's always beautiful to see a husband and wife, 20-something years, power couple, changing the game, uplifting, healthcare. I just want to thank both of you for being a part of this show this evening. And we're going to have to do a part 2. We got to stay on top of the science, on top of the stats. And if there's any other new techniques to make our lives easier in that exam lane, we want to make it happen. So again, thank you so much for being a part of the show.
It's been fun. Appreciate it.
Awesome.
Thank you, Dr. Glover.
For all my colleagues out there, thanks for tuning in. It's your favorite optometrist, Dr. Darryl Glover. Stay healthy, stay positive, and stay blessed. And most important, make sure you have a healthy posture. Until next time, peace. Hey, family, if you enjoyed this full podcast, don't miss out on more engaging content. Check out the next episode right here. And for the latest updates, hit that subscribe button and ring the notification bell. Your support means the world to us. Catch us in the next episode. Peace.